Okay. Our next speaker is Dr. Professor Prasert Assantachai from Thailand. He is a medical doctor from Mahidol University and a professor since 2009. And now he is the president since 2016, the president of the Thai Society of Gerontology and Geriatric Medicine. Now he's going to tell us about 3 settings of nutritional interventions toward WHO healthy aging in Thailand. Please, Dr. Prasad. Yes.
So it's quite challenging to speak in afternoon after lunch because somebody could get asleep, feel sleepy. All right. So I would first of all I want to thank the IC committee for inviting me to be here. I will talk about 3 settings of nutritional intervention toward individual healthy aging in Thailand. UN has proposed the concept of healthy aging as part of the SDG. The 17 goal of SDG, as you can see here, is the symbol of SDG. So it is to improve the life of older people, their families, and the community in which they live. So, at first, they proposed the concept of healthy aging by using the 3 main areas: health services, long-term care, and environment. And ICOP, as is here, published in the year 2019 as part of the health services. So hoping that the ICOP package can improve the functional ability with declining eating capacity as people getting older. You can see in the vitality domain, they also mentioned that frailty and sarcopenia is the target outcome of nutritional. So in my talk, I will cover all of this. The first one is the ICOP toward healthy aging in rural area in Thailand, and the nutritional intervention plus home-based exercise to reverse frailty in urban communities. And lastly, nutritional intervention to treat sarcopenia in the clinic. Right. In the ICOP, originally 6 domains has been proposed, but because we just do the pilot study, and we also plan to do the intervention as well, not just the screening, but provide intervention. So we choose to look at the 3 domains: locomotor, vitality, and cognitive capacity. But it's quite unique for Thailand that we initiate the other capacity, is the oral capacity, because it's related with vitality closely, as Professor Alignment comment this morning. So we start 4 domains. First, we use the Srabri province. It's about 100 kilometers north of Bangkok, and at the Gang Khoi district, the number of people is about 17%. And you can see in the pathway of the ICO, they have the 3 steps. Step 1, screening. Step 2, personal care assessment. So we have to talk about the human resource to carry on this project. The step 1, do screening committee. We don't have so much budget to do as Professor Bretter do in France. So in the step 1, we use the village health volunteer. And it's quite surprised that this system has been started in Thailand in the year 1977, more than 45 years now. And they are really one of the powerful weapons of Thailand to solve the public health. Who are the health volunteer? They are aged more than 18 years old, registered and live in the village more than 6 months, and some degree of literacy, and willing to volunteer to do good work for the communities. And you can see from the picture that some of them are young generation, but some are quite old. You can see that means the screening tool must be very simple. Do not need any technical skill to carry on. And in the step 2, we have the local health promotion center. They are not medical doctors, but they are trained medical personnel. so they can provide just the outpatient and health promotion activities. And you can see at the beginning, we have a meeting to tell them what's going on, what we are going to do to this local health promotion center personnel. And the step 3, because the step 3 to develop personalized care plan is quite challenging because it's a new things in our health system. So we use the district hospital doctor to carry on this. Right now, it's about 700 district hospital. And this picture show you that one of the district hospital dentist, she came to the community to do this activity in the communities. Right. Again, when we come back to the pathway, after we do the screening with 2 questions, and we can see that some of them may be normal, no any impaired capacity like this. But we cannot just sit tight and don't do anything. So we decide to provide them the self care. And you can see the self care appears in many spot in the pathway in this one. And when we use the nutritional status screening tool again, and if it's normal, the self care will be provided. And in the step 3, again, the self care also recommend at this point. But I'm quite surprised that in the WHO ECHO version, the first version, they only mentioned about mHealth mobile health to provide the nutritional, the self management in the smartphone. But we found that it's not work. It doesn't work in Thailand. Why? There are 4 reasons. The first one is although the mobile phone is quite cheap at the moment, but the smartphone is a bit expensive. So it's not affordable to all. And also, although you got the smartphone, some remote area do not have Wi-Fi. And again, to navigate to the mobile phone application, it needs some skill that other people cannot do that. And the last one, really important, you may have heard that right now in Asian country, there's a bad guy call center gang. So they make a phone call to the old people and try to defraud them the whole money in the bank account in the mobile application. So that's why a lot of people are very afraid of to get this smartphone. So what's the solution? So we decide to use the colorful picture booklet like this one. This is the cover of the booklet. And the inside of the booklet, there are some colorful pictures with some advice what to do so they can learn and practice more when they at home. Right, let's come to the step 1 screening. So we follow the WHO 2 questions. And if any question say yes, they have to proceed to step 2. But if no, that means there's no any declining capacity. The health volunteer will provide the self-care management right away at the spot. These are some examples in the vitality capacity, such as advice healthy diet, protein intake, physical activities, sun exposure to get the vitamin D, and this is very cheap and very effective to promote the family style meal and social dining. Right. Again, in the booklet, in a part of the vitality, have so many colorful picture to advise how to promote the diet, how to eat properly. Now, let's go to the step 2. The health promotion center personnel will do will assess more by using the M&A short form. And if the score 12 or more, it means normal, the personnel will provide the self care like provided by the health volunteer. But if the score is about 8 to 11, maybe in at risk of malnutrition, they will provide the self-care plus the ONS, oral nutrition supplement. And if it's severe, that means at risky of malnutrition, 0 to 7, they will refer to step 3 plus the high protein ONS. And also, as sarcopenia and frailty has been mentioned in this pathway, so we also do the screening by using the MSRA5 for sarcopenia and frail scale for frailty by the health personnel at the health promotion center. And if sarcopenia and frailty has been suspected, they will refer to the step 3. And the step 3, the district hospital will do the holistic assessment and 24-hour daily recall to find the cause of anorexia and poor oral intake. And they also provide a specific advice on nutrition and oral health and cross follow-up with the health volunteer. This picture shows you that the district hospital dietitian, she came to the communities to organize a teaching class for older people how to eat properly. Now let's go to the oral capacity, which is quite unique. First, we use the 2 questions to assess the oral capacity. By the first question is, do you have any difficulty in chewing various kind of food? The second question is, do you have any pain in oral cavity? If no to all, so that means no any problem. So they will provide self-care. And if yes to anyone, that means at risk. They refer to the step 2 by the health personnel center. The health personnel will assess with these 6 questions. That means that you have less than 4 pairs of teeth, including denture behind canine teeth, any loose or broken denture, any broken hole or unstable tooth, any ulcer, swelling, bleeding within oral cavity or lips longer than 2 weeks, dry mouth or less saliva which impair eating, difficulty swallowing, having choking with impaired eating. So if any one of these questions abnormal, that means declining of the oral capacity, they refer to step 3 to see the dentist. And if no to all, but they have some of this problem, the health personnel will provide the self-care for oral health. So when go to the step 3, the district dentist or the district hospital personnel will assess another 5 conditions about polypharmacies, more than 5 drugs. If yes, we will do the drug reconciliation at the hospital. Smoking, refer for further evaluation and advise stop smoking. Diabetes mellitus, so you refer to see the doctors in the district hospital to better control of the diabetes. And in nutrition, you see the dietitian. And poor cognitive ability, we will do assessment and do active advice according to the risk. So this is the strategy work for by the district hospital personnel. And regarding about the social and environmental aspect, especially about the access to the health facility, all 3 levels of healthcare personnel, health volunteer, health promotion center, and district hospital will together discuss about how to help them to get to the dental care unit, and about what about the social and environmental factors such as sugary drink, snack, something like that. Right. So these are the content in the booklet to help the people to do the self-care for oral health, such as brush teeth twice a day, brush your teeth at least 2 minutes, and the check to be checked by dentist every 6 months, and always use the fluoride toothpaste and clean the tooth gap with dental floss or others. at least once a day. And don't eat or drink after toothbrushing at least 2 hours, and clean your denture every day. So these are the main content of the self-care for oral health. So I think maybe you may have heard the concept of the WHO self-care. WHO first launched this package in the year 2019, and there's been going on about this. And this year, they have published the guidance for health system, covered all the 6 building blocks of this to promote healthcare. So from the basic definition, the self-care is the ability of the individual, families, and communities to promote health, prevent disease, maintain health, to cope with illness and disability with or without. Means with or without, that means that health personnel have to do some work as well, not just, oh, you do self-care, I don't have to do anything. No, to support of the health care provider. And you can see that old people stick to their lifestyle for many, many years. So it's hard for them to change their lifestyle. But there's so many theory about this. So the WHO adopt this concept by try to assess about the knowledge, the skill, and attitude of the older people as well as the health personnel to promote self-care. And self-care, there are many levels such as self-awareness, self-testing, and self-management. So these 3 areas has been must be taught to older people to do. Now let's go to the result. So after the 6 months of intervention, we do the step 1 by the health volunteer, about 399 cases by AAO health volunteer. And out of these, 189 cases are normal. Well, so in this case, we provide the self-care with the concept that I just mentioned previously. We not just sit tight, not do anything. And the step 2, about 210 cases has been under the care of the local center personnel. And you can see in the vitality aspect, 131 cases has impaired the vitality, and about 210 with impaired oral capacity. And it's quite surprised that at the level of at B, the community center, 144 cases can be successfully managed at this level. So this fulfill the concept of the WHO that you must done nearly everything in the community. And then about the others that the health personnel cannot manage, they refer to see the district hospital personnel, number C here. And what did they do? In oral cavity, the dentist will treat the tooth extraction to provide denture, and then refer back to the communities. And in the nutritional capacity, nutritionists will provide knowledge and follow-up, and also provide the ONS as well. And it's quite a surprise that just less than 10% that must be followed up and treated in a hospital. The other can refer back to the community to carry on the activities. What about the statistics? After 6 months of intervention, especially in the vitality domain, although the majority of them, about 70%, are stable in the vitality, 1/5 or 20% improve in the vitality. So this confirm that with this concept of the basal ICOP is quite successfully implemented in Thailand. Now, secondly, I move to another setting, is to reverse frailty in urban communities with this project. The main objective is to study the home-based exercise program plus nutrition education to reverse frailty. So we have done the cluster randomized control trial. In intervention group, we provide exercise and nutrition. In exercise, thanks to Professor Alai, who granted permission to us to use the Hip-Hop SEG 2020, designed by National Center for and Gerontology, Japan. And with this package, we do the on-site training as well as to create a colorful big poster and a video post online for them to see the poster every day, and they can access to the video online to practice it. I forget to tell you that this project has done during the COVID-19 outbreak. So that's why we cannot follow them face by face. And in division, we also provide the on-site education user content by Nutritional Institute, Mahidol University, and also the big poster and video online as well. And in this group, we follow them with the telephone call, at least 10 calls. We cannot visit them because of the COVID-19 at that time. And this is the picture of the NC Hip-Hop. You can see this is the cartoon with the instruction is quite easily to understand and to follow each type of exercise. And the control group, we just provide the basic knowledge and advice on the healthcare and the booklet about exercise environment, not doing with the exercise or the vitality. Now, you can see this is the picture show you the activity that we done in the urban around our hospital. Right. So out of the 667 subjects, about 140 has been enrolled to 70 in intervention group and 70 in control group. And of this, we allocate pre-frail and frail in both group. And then let's see how things go. Right. So after 3 months of intervention, we assess again, and we can see those who reversal of fertility transition. That means pre-frail to robust, or frail to pre-frail or robust. This is in the reversal group. But in the non-reversal group, it covers the pre-frail to pre-frail or frail to frail. And you can see it shows that with this package, with just 3 months, it significantly improved. It can do the fertility reverse with statistical significance. So we have done about the other study like us. Like the first one, Luger in the year 2016 in Vienna, Austria. They done the 3 months as we have done with the exercise program plus nutrition. And the study show that the MNA long form score improving. And they use the survey of health, aging, and retirement in Europe. Fertility index score they also improve. But we are really glad that to know that another study done in Miaoli General Hospital in Taiwan, published in the year 2019, the design the same as we have done, but in this study, nearly 90% of them are pre-fail. And you can see that in the exercise group, in nutritional group, also improve with this 6-month intervention. And the combination also improve with statistical significance. So I think we want to echo what Professor Lim Bi-song just mentioned, that nutrition plus exercise is the must, not just alone. Lastly, you have heard that about the ONS, the oral nutrition supplement. So we have done a study to use this to treat sarcopenia in a genetic clinic setting. This study, we use our own ONS. So we use the chicken-based ONS because you can see in a commercial formula, it is quite expensive for the people to afford it. So we studied this. The inclusion criteria is age 70 years old or more and BMI less than 23. So these are the formula of our chicken-based ONS. Each 100 meals contain 100 of kilocalorie of energy, 3 grams of protein, and so on. And we provide the 150 meal little pouch, and we advise them to take it once a day. And we have done the randomized control trial on the one arm with chicken-based, one arm with the placebo. And we measure your usual gait speed. You can see that in the high level of physical activity, the visual gait speed is much better than those who have low level physical activities. What does it mean? It means that those with more activity will benefit most from the ONS. Another marker is quite interesting because we also add the vitamin D and calcium, and we measure the bone marker. You can see that beta cross-lab, which are the bone resorption marker, is decreased significantly after 6 months. And the other markers, P1NP, again, significant difference between the ONS and the placebo. So in conclusion, I show you 3 lessons learned from the study that the virtual ICOP can be implemented in the rural area in Thailand. And we also done the nutrition education plus home exercise to reverse frailty in urban communities. And the protein-based ONS show some benefit in malnourished or patient in genetic clinic. And the last one, nutrition and exercise, is the way to gain the kingdom. So thank you so much for your attention.
It is indeed a good news. Nutrition and exercise is effective, isn't it? Okay, let's hand to the third.